There are many myths associated with the IVF procedure. Today I am going to burst these myths one by one. The first and most common myth associated with IVF is that it is a predominantly female problem, because female is going to bear the child, so the problem is with the female, that's why she's not getting pregnant. So this is a very important myth. Normally the infertility is 40% a male issue, 40% female issue, and 20% it is a combined problem. So male is equally responsible for infertility as female. So whenever a couple who have been trying for naturally for almost a year and have been unable to conceive, they need to see an expert post trying for 1 year. And both male and female have to be investigated to rule out the reason for infertility. Definitely the procedure of IVF requires a lot of dedication and demands multiple visits as well as regular injections. With the advancement in science, these injections are now available in a very refined form, in pen form, where patient can use these injections and even self-inject themselves at the comfort of their home with minimal pain. These needles are very fine and cause minimal discomfort to the patient. Now, after the injections are given, removal of egg from a woman's body, which is called egg retrieval, is usually a very short procedure of less than half an hour, which is done under anesthesia, and post-procedure patient may feel slight discomfort in her belly, for which certain pain medications are prescribed. And usually the patient doesn't feel severe form of pain, and they can resume their normal activities and routine work from the next day itself. Similarly, the embryo transfer procedure, which is followed by egg retrieval procedure 5 days later, is a very simple OPD-based procedure, and it does not involve any sedation or anesthesia, and its patient is made comfortable, and it's a short procedure of 10 to 15 minutes where an embryo is transferred through a small flexible catheter inside a woman's uterus. So it's a very simple procedure without any pain. So overall IVF procedure is painless. Overall IVF is not as painful as it is considered to be. Pain perception varies from patient to patient, and there are medications available to tackle the same. One of the common myths of IVF is that it's not a safe procedure. It's a myth, as it's a very safe procedure. The risk of complication in IVF is very low, less than 2%, and the patients who might be at risk of any complications are screened prior to starting the procedure, and then they are managed accordingly. Another common myth associated with IVF is that IVF babies are abnormal. So the risk of having any abnormal baby with the IVF is as same as of the general population. IVF procedure per se does not lead to any transmission of any genetic abnormality in the babies. Since the birth of first IVF baby, that is Louis Brown, in 1978, millions of babies have been born through IVF, and many of them are pursuing a successful career in various fields now. So it's a myth that IVF may lead to any genetic abnormality in the babies. IVF pregnancies are always twins and multiple pregnancies. This is a myth. Generally, IVF procedure involves transfer of 2 to 3 embryos, which may result into multiple pregnancies. But due to advancements and various procedures like pre-implantation genetic testing available, we usually screen for the best embryo, and in women who are young, we transfer single embryos to minimize the risk of multiple pregnancies and associated complications. Another common myth associated with IVF is that IVF babies have to be born by cesarean delivery only. That is not true. IVF babies are as normal as normally conceived, naturally conceived babies. The antenatal care of all the IVF pregnancies is almost similar to the naturally conceived pregnancies. The cesarean delivery is indicated only in case where there are indications, obstetric indications, or when there is any complication associated with the baby or the mother, then only the cesarean is indicated. Otherwise, IVF pregnancies can be managed as natural pregnancies and can have normal, healthy vaginal deliveries.